Hello, my name is Abigail Orchard. I'm the lead cancer nurse at Dorset County Hospital. We've put together this short film to help inform you as patients and family about the hospital prior to you coming here for investigations or treatment for cancer. We hope you find this video helpful and informative before your visit to the hospital.
Getting to the hospital. If you're coming by car, the hospital is well signposted as you approach Dorchester. Car parking on site is limited at the time of making this film. However, a multi-storey car park is currently being constructed, which will increase the parking capacity significantly for patients, visitors and staff. Parking is a pay and display. Tickets can be purchased at the machines located at various points around the car park. The ticket machines take cash payments, or you can pay via mobile phone. If you are receiving chemotherapy at the hospital on a regular basis, there are a small number of designated car parking spaces set aside for you which are free of charge. You must have an exemption form which needs to be placed on the dashboard of the car. Whilst we cannot guarantee you a space, you will find there is usually capacity. The chemotherapy car parking spaces are in the north wing and are clearly signposted. Getting to the hospital by public transport. There is a bus stop directly outside the hospital on Bridport Road, which has regular bus services connecting to Bridport, Weymouth, Portland and some of the surrounding villages. If you come to Dorchester by train, Dorchester South and Dorchester West railway stations are about a 10-minute walk from the hospital. There are also a number of covered bicycle sheds at the hospital. These are located within the car parks and are clearly visible. The hospital has several entrances. The main entrance is the North Wing 2 entrance. There is a second entrance into the North Wing which is accessed via the side of the building adjacent to the car park. There are two entrances to the South Wing. There is also an entrance to the East Wing for women's health. All entrances and exits are wheelchair accessible, and hospital wheelchairs are available throughout the site. There are vending machines selling food and drinks, and there is a coffee shop in the north entrance selling hot and cold drinks and snacks. There is a hospital shop which is in the south wing. This shop is managed by the Hospital Volunteer Service. There are several toilets spread throughout the hospital in all key areas. There are a number of disabled and accessible toilet facilities within the trust. Baby changing facilities are available in a limited number of toilets. The Diagnostic Imaging Department is situated in the South Wing Level 0. In this department, patients receive X-rays, CT, MRI and ultrasound scans. Biopsies and other procedures can take place here under X-ray screening. The Robert White Outpatient Department and Radiotherapy Unit are both housed in a building adjacent to the north wing of the hospital. The ground floor accommodates the Radiotherapy Satellite Unit, which is managed by staff from the Dorset Cancer Centre in Poole. The first floor of the Robert White building accommodates haematology and oncology outpatient services. There is a lift and stairs to access the first floor. The hospital runs 3 phlebotomy clinics, one at Weymouth Community Hospital, one in the main surgical medical outpatients at Dorset County Hospital, and one in the Robert White Outpatients Department. Currently, patients must have a pre-booked appointment to have a blood test. The Fortunes Well ward is a 15-bed inpatient ward specialising in cancer and haematology care. The ward is situated in the North Wing. The ward comprises of 2 single-sex bays and 5 single rooms. Visiting arrangements to the wards are currently restricted due to COVID. Please check with the ward staff regarding the current arrangements. The Fortunes Well Day Unit accommodates patients receiving chemotherapy, immunotherapy and other cancer treatments. All patients have electric recliner chairs to aid to their comfort while attending for treatment. Patients are welcomed by the receptionist, who will then inform the nursing staff of their arrival. Patients can be in the department for anything from half an hour to 8 hours. The chemotherapy unit is open from 8:30 a.m. to 6 p.m. Within the Fortunes Well Day Unit, there is a small pharmacy which is responsible for the preparation dispensing, and in some cases the delivering of oral chemotherapy, other cancer treatments and supportive medicines. The Fortunes Well Pharmacy is open from 9 a.m. till 5 p.m, Monday to Friday. Many patients with cancer and haematology conditions receive care in the Medical Day Unit. The unit is situated in the South Wing. Treatment such as blood and platelet transfusion, immunoglobulins, and iron infusions are administered here. The Endoscopy Department is situated in the North Wing. Patients requiring endoscopy procedures, including gastroscopy, colonoscopy, and bronchoscopies, will attend this department as an outpatient for their procedure. There are several outpatients departments at Dorset County Hospital, including the main surgical medical outpatients, which is situated between the North and South Wing, also the Women's Health Outpatient Department, which is situated in the East Wing, Ear, Nose and Throat and the Maxillofacial Outpatient Department, which is situated in the South Wing. Dermatology outpatients, which is situated within the main medical surgical outpatient department, oncology and haematology outpatients clinics take place in the Robert White Outpatient Department. We are extremely fortunate at Dorset County Hospital to have 3 reflexologists who work with patients affected by cancer. The 3 members of staff are funded by the Fortunes Well Cancer Trust, a local charity who provide generous financial support to Dorset County Hospital Cancer Services. The Emergency Department. This is an extremely busy department within the hospital. Attendance at the emergency department should be reserved for people who are seriously ill and require emergency treatment. For less urgent requirements, patients can seek help from their GP or 111 services.
Thank you for watching. I hope you found this short film helpful and it has managed to allay some of your fears and anxieties about coming to the hospital. If you have any further questions, please don't hesitate to ask the hospital staff for more information.